And it was fantastic, and where we really, it's not very often that we actually get to connect with young people, with Black young people across our province, and bring them together from all sections of our province, and have a wonderful time together and get to hear their voices. And it's not just a time for us to inspire them. I think they inspire us more than we could even hope to inspire them. So really want to appreciate the One Vision, One Voice team for hosting such an amazing session a couple of weeks ago, and all of your hard work. And so this is a continuation of the amazing work and leadership that's done by this team that we're about to engage in and talk about today. And also appreciate U of T colleagues who are here. And we're going to get more into the introduction of everyone who's here in a bit. But just really to say how much I appreciate your partnership, the stakeholder engagement, that you have true passion to come alongside with research support, your analysis, and really partner with us in this area of understanding anti-Black racism and using the tools of research in order to do that. So in particular, just really want to appreciate your leadership in this space, Dr. Fallon, and we'll hear more from you, but also amazing team that is with you today, which we'll also hear more from. And I'm looking at Maya's face as I speak right now. Good to see you, Maya. So we will, so I'm looking forward to our conversation today. One of the, there's a quote that I really love, and it's a simple quote by Sojourner Truth, and it says, "Truth is powerful and it prevails." And even as Keisha opened today with a land acknowledgement, certainly centering truth and reconciliation within our space in terms of understanding and acknowledging Indigenous overrepresentation and the disparities that have existed for FNMI children and youth for so many years, more years than we can count within the child welfare system from its inception. The existence of overrepresentation and disparities with regards to First Nation, Inuit, and Métis children and youth have existed. And so when we look at the impact of that, and we looked at the colonial structures as different settlement groups interacted with that same colonial structures, we see very same patterns fulfill, and those same disparate outcomes happen. And in particular, we're centering and focusing on the impact of Black children and youth and families that interact and intersect with the child welfare system, and the impact that happens. And one of the disturbing pieces is when we look at kind of this quote, when I reflected on this quote around truth is powerful and it prevails, that there has been distortion of truth, that over the history and legacy of child welfare, the truth of Black families have been distorted. The truth of Black families have been reconstructed to formulate lies around the community, and mistruths and misunderstandings that have embedded itself within how we evaluate Black families, how we engage Black families, and really looking at it looking at Black families through a deficit lens, and understanding that truth of the matter is that the existence of white supremacy, the violence that Black families work within, that structural systemic, those structural systemic barriers and violence that exist, that despite that Black families continue to not only survive, but thrive despite the harsh barriers that is not just existing within 2022, but that there's a strong history and legacy, again, from the inception of child welfare in this regard. But in spite of that, Black families continue to love and protect their families, and that's the truth. The other truth is that I love this quote by Akua Benjamin that talks about the fact that resistance is in our DNA, and that's the truth. And so as we speak about truth from the place and space of understanding data today, we're hoping to enlighten and shed a different kind of truth than what has been propagated through child welfare for many, many years with regards to Black families. And that using research as a powerful tool, as a tool of emancipation and as a tool of liberation is what we are setting out to do in our work with U of T as we work together to address not only anti-Black racism and expose the fact that it exists within our systems and that it's pervasive, but also the existence of white supremacy, which is the toxic backdrop that informs anti-Black racism. And so as we engage conversation and in data today, that is the situation, that's the context that we come at you with, certainly not having all of the answers, because I believe that good research and good process brings about more questions and more questions of interrogation, more questions that unsettle us than answers that can be brought forward. So we know we would have done a good job today if we're left with a number of other research questions that we want to dive into and areas that we want to know more about. So having said all of that, the other piece that I wanted to also say is that we know that research is also not perfect. And as we try to pull together and the analysis of what is this imperfect data telling us in terms of the truth of our current context is really, it's about the analysis, and it's about the analysis making our practice better and bringing about system transformation as opposed to just the data itself. The data itself is nothing, but what we want to be able to do is use it as a transformative tool in order to really change outcomes for children, for Black children, youth, and families, and quite frankly, for all children, youth, and families, but especially when we look at those who are most marginalized, and if we change the system for them, we change it for everyone. So those are my thoughts as we open up today. So excited to get started in terms of not only our data presentation, this is not one directional, but our collective community conversation that I'm inviting you in today to participate and engage and think through and struggle through with us as we engage this process. So thank you for being here. And back over to you, Keisha.
Thanks, Nicole. So we're going to send it right over to Dr. Barb Fallon and team for them to start their presentation on the data.
Thanks, Keisha. Am I sharing the slides?
We can share them, or you can share them, whichever.
I just wanted to,
Okay.
So, can you see my screen?
Yep.
Okay, perfect. Thank you so much. And thank you to Nicole and to Keisha, to Shazara and to Vanya for your gracious invitation. And as Nicole said, it's been such a great, well, it is a privilege on our part to work with this amazing group and to use the data to elucidate some of the key questions around the overrepresentation of Black children and families in the child welfare sector. So I'm going to sort of start us off, and then Nicole and Keisha and I will speak about the Ontario Incidence study and some of the findings that will be in the One Vision, One Voice overrepresentation report. And then Bryn and Trevon will review sort of how together as a team we've structured it. And then I just wanted to make sure that I think Bryn, Trevon, and I are here from the U of T side, and Maya, Kagan Cassidy, and Keisha William are also listening to the presentation, but really have had such a seminal role in the production of the report. And Nicolette Jo Carnella and Tara Black could not be here today, but we send our appreciation to them as well. And so just to kind of remind people where these data came from, which is good in terms of kind of setting the context, and as Nicole said, sort of, really being conscious of the limitations of the data, both the strength and the limitations of the data. In Ontario, really, we are the only jurisdiction in North America that has had 6 cycles of the incidence studies, where every 5 years, we ask workers to complete data collection instruments, and we are able methodologically then, during a 3-month case selection period, to weight the data to produce an estimate of the number of investigations that were conducted in Ontario. And in this case, it's 2018. To let people know that the National Incidence Study, which was a project directed by the Assembly of First Nations through the University of Toronto, those data have also been released. The Ontario data are nested within the Canadian data, and certainly there is marked overrepresentation nationally of Black children and families when we look at the data for our country. We are in the process of doing a lot of secondary analyses, and certainly the major findings report for the Ontario Incidence Study is on the CWRP. I think it's probably on the OACS website. And we've also worked together with NASCIO through Amber Crow and Jeff Schiffer, who have authored a report about the First Nations overrepresentation of children and families, and that is available on, I think, also OACS website, NASCIO's website, and the portal. And we are advised by an amazing group of people. Nicole Bonney is one of them, who really sort of work with the research team to make sure that the study certainly reflects principles of community, principles of OCAP with respect to First Nations, Métis, and Inuit people, and that we are working in service to children and families. And so thank you to them. And I know this is not everyone's favorite slide, but just to remind people of how the data are essentially constructed. And the first thing that we do, variations over 6 cycles. I will not tell you what those variations are, although people can message me afterwards if they're really wanting to know. But essentially, we stratify agencies and then we randomly sample. In Ontario, what that means is essentially an executive director gets a call from the research team asking if they would consider participating in the Ontario Incidence Study. Because though that site selection is representative, we can then make a knowledge claim that is representative. Case selection period, October to December, we asked workers at the investigation to tell us about children who either there was a specific allegation or suspicion of maltreatment, or there was a concern about future risk of maltreatment. In 2018, because the legislation changed on January 1st, 2018, the age of protection was raised to 18 or 18 or 17 and under. We also have data about 16 and 17-year-olds. And so the estimate is about 158,000 children who were the subject, or 158,000 child maltreatment investigations were conducted in Ontario in 2018. When we look at over time, we take the 16 and 17-year-olds out of the analyses because we want to make sure that the age is comparable from 1993. I'll just quickly remind people that these data are cross-sectional. They're not evaluative, meaning if a child is placed at the end of the investigation, we can't tell you whether that is the right decision for the child. We can just tell you that that child was placed. Certainly when we're doing any comparisons, there have been some methodological changes across cycles. And there's always error terms when we weight data. We can't quite account for seasonal variation, although in subsequent analyses that we've done, we're not that concerned about its impact on the provincial estimates. Again, moving quickly, happy to take questions afterwards, but and Nicole will look essentially at a very similar slide with the overrepresentation of Black children and families over time. But in general, the number of children in 1993 who were referred to a child welfare authority in Ontario for concern of child abuse and neglect was about 2% of the population. between 1998 and 2003, with implementation of a risk assessment model, we see that the number of children doubled. So we went from just under 3% of the population to about 5.5% of the population, or 53.59 per thousand. And then by the time we get to 2018, we can see that it's a steady state with respect to the rate per thousand investigations. Although in 2018, we see essentially a 1% population increase from 2013 to 2018. Not statistically significant, but certainly I would say clinically significant in that we are identifying another 1% of the population for a child protection investigation. Certainly in discussions with the One Vision, One Voice team, we've highlighted a number of sort of implicit kinds of policies that are not necessarily explicitly recognized or understood, including exposure to intimate partner violence. In 1993, there is not a concern, a child that is reported to a child welfare authority in Ontario for a concern around intimate partner violence. And in 2018, it's almost half the work of the child welfare system in Ontario. Almost 50% of all substantiated maltreatment have to do with a child being exposed to intimate partner violence. We've done several analyses around physical abuse, and working with Joan Durant, we've mapped that onto Section 43 and the decision of the Supreme Court to uphold Section 43 with specific caveats. In that, corporal discipline by caregiver is allowed for children between the ages of 2 and 12 for the purposes of correction, so that the child can understand, and that does not leave a mark. And when we apply the Supreme Court's upholding of Section 43 to substantiated physical abuse investigations in the Ontario Incidence study, we find enormous confusion. In that 82% of physical abuse investigations in our sector, there is no physical harm. And in 1 in 4 substantiated cases of physical abuse, it did not exceed even one of the course limits. So the upholding of Section 43 with specific caveats has left enormous confusion in the field. Quickly, just conceptually, we're trying to understand, the differences in investigations unpacked from maltreatment types, and we argue through a taxonomy that we call our urgent chronic one that there are underlying constructs for investigations where, arguably, the nature of the allegation means that the child is at has an urgent protection concern, so the protection part of our legislation, and that there's a group of investigations really where, no less important, but the concern is more around the chronic long-term psychological harm to the child. So that we call that the well-being part of our mandate. And we've developed a taxonomy that we use both in the incident study and then to sort of understand recurrence through our OCANS data system. And what we find is when we model the data over time using the 6 cycles of the Ontario Incident Study, we see that there's a very different population being identified to Ontario Child Protection Services between 1993 and 2018. In 1993, 1 in 2 investigations were for urgent protection concerns. And in 2018, less than 1 in 10 investigations involve an urgent protection concern. So a very similar child protection system, a very different population coming through the front doors of a child welfare authority. And I think maybe I will, since I've probably spoken too long about many of these issues, I'm going to turn it over to Nicole.
Thank you, Barb. And as always, thank you so much for your amazing work and analysis. And I do want to say also that if this is sounding familiar to folks, that we have done the similar presentation previously and wanted to do it again as a bit of a level set and contextual exercise this morning before we went into the report. And the report that you're going to be introduced to has been informed by a lot of the components of the Ontario Incidence Study report and a lot of what you're hearing today. So if you are saying this sounds familiar, it's because it probably does, because you may have heard it in another space. But I do want to go back to Barb's point around in 1993 and 98, Black children were equally represented in the child welfare system in terms of the impact, the sector-wide implementation of ORAM in 2000 and the impact that that made in terms of the huge overrepresentation that we saw within that implementation, and that it quadrupled, investigations quadrupled that we saw in 2003 in terms of those incidences. So white children doubled in terms of numbers in their investigation, and Black children quadrupled. So just wanted to note that. And prior to the 2015, the Ontario Incidence Study, the only province-wide source of census ethno-racial data as it pertains to child welfare on an identity basis. So we did not have any kind of research instruments that were actually collecting data in relationship to race. And we know that that this certainly continues to be a gap and a struggle within our system in terms of being able to collect race-based data where we can see these types of patterns and actually have them there as a point of analysis when we talk about level setting through truth. But one of the things too that I wanted to mention and kind of connect a couple of dots. So for those of you who attended the session that with Dr. Ken Hardy a couple of weeks ago, when he spoke about how the anti-racism, oppression, anti-Black racism, the tools through which we see the vehicles that kind of execute the anti-Black racism within our system are through those kind of, he called 4 pernicious P's. So the policies, protocols, procedures, and processes. And so we could see that this example around the fact that here we have a change in policy that immediately brought this huge disproportionality and disparity in terms of the entry point and gateway, which is why we need to be so conscious of how process and protocols and policies are executed within our organizations, because often you're not going to, there aren't these flashing lights around anti-Black racism that happen within our system. It actually is embedded through the processes we engage in every day, and it hides our decision-making, hides itself within these types of protocols and processes and policies, which is why we need to constantly evaluate and unpack them. So I just wanted to kind of link kind of how it works its way through practice and how kind of it embeds itself within our structures and is invisible and hides within how we do our work. So wanted to just note that. Next slide. So many of you are also very familiar with the terminology of disproportionality, but again, just from the sake of, for the sake of level setting, that disproportionality looks at kind of the compare proportion of children who experience specific outcomes in terms of investigations, and really looking at the rate of those investigations in comparison to kind of baseline numbers. So if we look at, in this case, when we compare white children to Black children, in the first image that you will see that white children being 60% of the population, of the child population within Ontario, and Black children represent 7%. But and this is 2018, right? These numbers can change now in 2022. But when we look at now investigations in relationship to child welfare, that Black children are 13.9%, which exceeds kind of their population number of 7% of the investigation, and white children actually are investigated at a lower rate than their actual population. So when we talk about disproportionality, this is what we're referencing in terms of as an example of that. Next slide. And of course, disparity really, when we look at the disparity, meaning the lack of similarity, when we look at the poor outcomes that are attached, and oftentimes there's confusion, like I know that people conflate the two things. So for instance, you could have an organization within child welfare that does not have a disproportionality problem, but you have a disparity problem. So you don't have an overrepresentation of Black children in care. You could even have just a few, right? But of the few that you have, there are poorer outcomes. When you look at the outcomes that are attached to them in comparison to white counterparts, the outcomes is low. So whether that be that they're in care longer, whether it be that they're transferred to kin care less, whether it be their education outcomes, their graduation rates are less. So the different indicators of wellness, there's poorer outcomes attached, where that's where you would see the terminology around disparities being used. So it doesn't mean that you can have disparities within populations within your organization without having a disproportionate number, right? So just to distinguish between those two meanings. Oh, okay. So when we look at this particular slide in terms of looking at investigations, that we see that the investigations for Black children around the fact that the overrepresentation exists. So not only are we seeing the overrepresentation of Black children in relationship to white children, but we're also seeing the fact that there's overrepresentation when we look at Latin American children. And I know that there's work underway in terms of working with Dr. Henry Parada to interrogate this overrepresentation of Latin American children and youth in care. And of course, within our Ontario context as well, that we know that First Nation, Inuit, Métis children continue to be vastly overrepresented as well. So we look at, and then we also look at the fact that there are other types of overrepresentation that happen across the board, including Arab, West Asian, Southeast Asian, and again, our apologies, because this is labels in relationship to the census data, right? So, so for classifications and in terms of communities that we typically don't use, it's because it's aligning with census data. But we're also seeing the underrepresentation of communities as well through this graph. So just wanted to show you the example of disproportionality just through a different lens. Keisha?
Thanks, Nicole. So in our next slide, we see the disparate representation of Black children in the Ontario child welfare system in 2018. So we see that compared to white children, Black children in Ontario were, sorry, this thing. Oh, thanks. I saw this thing just came up across my screen. Sorry about that. That Black children compared to white children in the Ontario child welfare system were 2.2 times as likely to be investigated, and that these investigations were 2.5 times more likely to be substantiated in the example of maltreatment as well. So 1.7 times is likely to be transferred to ongoing services, and 2.5 times is likely to involve a placement in out-of-home care. So when we go a little bit deeper into the report that we're going to be sharing with you later, these figures, these tables are also included. So it gives everybody an opportunity to see exactly how the numbers are being represented. We can go on to the next slide as well. Great, thanks. So in terms of disparate investigation outcomes compared to white children, Black children are 16% more likely to be substantiated, and 15% more likely to be placed during the investigation, and 21% less likely to be transferred to ongoing services. I believe this one's back over to you, Nicole.
Thanks, Keisha. Is this you, Barb? So you guys get to witness the organic dance that happens. It's well coordinated until it's not. Um, But in any case, so when we look at the primary caregiver and the functioning, this was a very fascinating slide for me. As you can see, the blue line representing Black parents and the orange line representing white parents. So when we look at least one child functioning issues where we see white parents exceeding in terms of with having areas and quote unquote issues, documented issues in this area, that we see that them exceeding. That in terms of primary caregiver with a mental health issue, again, white parents exceed in terms of having that issue. We see that when it comes to primary caregivers with few social supports, this is where you see a slight uptick of Black parents around the few, oh, I think the slide just, thank you. With having few social supports. And then we see at least one primary caregiver with risk factors that white parents actually exceed in having these types of risk factors. Now, the reason I found this particularly fascinating is because if you were to ask me for the rate of investigations that happen against Black parents, I would have assumed that Black parents would actually have been the ones in every category to have to be functioning with an issue, mental health issues, caregiver with a problem, all of those things. But in fact, even though Black parents are investigated at a higher rate, the only area where we see Black parents exceeding in terms of having quote unquote through these categorical issues is around the social supports. Which certainly wouldn't match the narrative that we often see in case notes and the narratives in actual case conferences and how Black families are discussed, which actually goes back to my point earlier around the power of truth, and that really unpacking that truth through using this data in understanding that the incongruence between what we see in documented data versus the actual experience that happens within and how decisions are made within child welfare and the disconnect between those two. But Barbara, happy to hear your thoughts on this as well.
Yes, exactly. Yeah, we do not see, when we look at the proportions of these concerns noted in investigation, there are more likely to be reported for investigations involving white children than Black children. Yes, absolutely. And these are just to remind people that these are we asked the workers to complete a data collection instrument at the 45-day point nationally for the major assessment period for the investigation. And there are, I think, up to 18 child functioning concerns that we would ask them to comment on: confirmed, suspected, no, unknown, confirmed it's diagnosed, disclosed, it's on a previous file. You suspect this is an issue for the child, no, it is not, or unknown, you don't know, you haven't asked the question. So these are, we have the data, and I think in the report around a more fulsome kind of discussion around these, but we see a similar kind of trend.
Exactly, thanks, Barbara. So here we look at the socioeconomic circumstances, and Keisha, do you want to kick us off with this one? Or happy to keep going, it's up to you.
Sure, no problem. Sorry, just one second. So yeah, so in terms of socioeconomic circumstances, we were looking at household income, comparing Black children and Black families and white families. And we can see the difference of 48% and 54% between Black and white families. We also looked at household income, the benefits for EI, social assistance, and the difference there being just a little bit different. Household ran out of, sorry, I can't really quite see this. I just have to make this a little bit bigger. There we go. Household ran out of money for at least one basic necessity. We can see that that portion is tied. And in terms of home ownership, we see the difference is a little bit larger, between 19% and 36%. When we look at public housing, we can really see that there's quite a bit of a large gap there in terms of 21% to 8%. So what we found out in general is that investigations involving Black children were less likely to be identified as living in their own home and relying on full-time employment as the household income, but were far more likely to be identified in living in public housing compared to those involving white children. When we think about public housing and what that means in terms of the over-surveillance of Black families, we know that that's one system that's also feeding into this overrepresentation that we're seeing here as well. So,
absolutely. And that slide really also speaks to the larger, when we look at social determinants of health, and just in terms of how anti-Black racism would be experienced around securing income, full-time employment, how that would now impact food security, housing. So we see that from a social determinants standpoint, how this plays out in terms of just the living and the impact that that would have for Black families. The next is around referral sources, and I'm sure that this comes as no surprise that when we look at the referral sources that refer Black families to the attention of child welfare, that schools are the highest referral source. Again, this is within our Ontario context, and that we see that with 43% of responsible for 43% of the referrals when the data was examined and looked at, and only 28% as it related to white families. Second, we saw police. Then we see any non-professional. And Barb, could you give examples of what would be in this category in terms of non-professional?
So that would be a child themselves, or his or herself, a custodial parent, a non-custodial parent, a neighbor, a relative.
Okay, excellent. Thank you. And then we see community and health and hospital, where those are the two areas that we also see white families being referred at a higher rate. But in particular, as we highlight kind of schools, and for those who have been following the news, that you would have seen, for instance, the example of the 4-year-old, where the 4-year-old child in Waterloo, where the police was called within the school system because they were having, a tantrum, but calling the police on a 4-year-old within the school context, that we not only see the impact in terms of child welfare and the intersections in the pipeline of child welfare, but also that of police and criminal justice, and how how Black children are criminalized within the school systems, but also leading that pipeline in terms of the most, they're our highest referral in terms of the work that happens within the schools itself, and how they evaluate and assess Black families and Black children, and how anti-Black racism makes its way through that analysis on a day-to-day basis. So this certainly illustrates that as well. And in terms of investigation reasons, we see here that the highest reason for investigation with Black families through this study is around physical abuse. And then we have actually, they're both, when compared to Black and white families and referrals, we see that the 3% around sexual abuse are equal. But in every other category, from neglect to emotional maltreatment, actually exposure to intimate partner violence, there's a slight difference there as well, in terms of 18% in comparison to 17% of white families. And then risk of future maltreatment. So what I think is really important here in terms of when we see the importance of physical abuse in terms of the highlight of that, and I want to connect that to some of Barb's opening remarks that she made at the top of the the slides, I believe it was slide 9, that talked about when physical harm is noted, it primarily involves bruises and scrapes that are not judged to require medical intervention. But, you know, kind of talking about that there's such a disconnect between what is permissible by law in terms of quote unquote disciplining your children physically, that it is not illegal, but yet Black families, in terms of where we see the tension and contradictions hit up against systems is when it comes to looking at physical harm cases and opening them up in relationship to child welfare at a higher rate. That even though there is also this disconnect in terms of what it is, what's considered a criminal or unlawful versus lawful act when it comes to corporal discipline. So really wanting like that there's certainly an area here to further interrogate in terms of how Black families are categorized as being violent, irrational, how that type of decision-making and the fear around Black parents and parenting, and how the decision-making and analysis gets made within cases, and the fact that they get opened at a higher rate, and they also get called in at a higher rate. So just that there certainly is no surprise to me around the existence of physical abuse and the fact that it is at a higher rate, and the connection between the violence and criminalization of Black bodies, period.
I think Nicole and Keisha, this is over to me. So it does, we're just commenting this morning, it seems like a long time ago, but I mean, it seems like a short time ago, but it was 2 years ago when we presented these data to the sector. One of the analyses that we included was a logistic regression, and that is just a way to statistically control for the concerns of the investigation. So everything that Nicole and Keisha spoke to around what was the nature of the allegation, was there physical harm, was there emotional harm associated, what was the functioning of the caregiver like, were there concerns around the children, and essentially, you know, what were the kind of circumstances, the economic resources available to that household. So it's a very much an ecological kind of approach. And certainly it's things that workers pay attention to in the service dispositions that we would measure in the incident study. And certainly we've just given a little bit of indication that these are things that would be considered in the not only the child welfare literature, but the child maltreatment literature. And so we asked the question, if we were able to control for the clinical concerns of the investigation, for the context of the investigation, then would it matter whether or not the child was Black or white? And so in doing that logistic regression, I have to make this smaller, we can see that the clinical concerns of the case certainly drive the service disposition. In this instance, we're looking at the decision to place a child in out-of-home care, which is one that we would measure in the incident study, whether or not the child was placed in out-of-home care. The clinical factors, of course, are highly related to that decision, to the presence of child function concerns, the caregiver factors, the household context, and the characteristics of the investigation with respect to the nature of allegation and whether or not there was physical or emotional harm. So highly related. What we found, though, that when we essentially made Black and white investigations the same and then asked, does it matter whether the child is Black or white, we see that it does. So an investigation involving a Black child is almost 2 times more likely to be placed in out-of-home care than an investigation involving a white child. I'm not sure, is this me again? Or yes. I think it is. Okay, so we're about to wrap up. So just to highlight some of the findings, and then that will be a nice way to kind of pivot to the report of One Vision, One Voice. Certainly the work that Nicole spoke to, the Kofi Basiaco did the sort of analyses from 93 to 2013 and found that, when we look at the rate of investigations involving white and Black children, the implementation of ORAM, sort of a risk assessment instrument that arguably codified structural risk at the individual level, we can see evidence of that hypothesis, because the number of investigations for white children doubled, for Black children they quadrupled. In 2018, investigations are 2 times more likely to be transferred to ongoing services. So this is with a population denominator, 2.5 times more likely to be substantiated, and 2.5 times more likely to result in a placement. And then just to reiterate that when we essentially sort of statistically control for the concerns for the child and then introduce race, that Black children are still more likely to be placed in out-of-home care, even after controlling for the concerns of the investigation. And so I think my job is now to stop sharing and pause.
Thank you so much, Barb, and thank you, Keisha. And just if there's any specific questions around the PowerPoint, we could take 1 or 2 now, or we can take them all once we see the report, and then we can just have a more fulsome discussion and conversation. Are there any burning questions right now? Okay, so as folks continue to kind of sink in with some of the information that we just shared, because I know it takes a minute to have that sink in. I really, just for us to pivot to this, to really looking at this overrepresentation of Black children in Ontario report and understanding that. I really want to take the time to specifically, I know I've appreciated and thanked Barb for her amazing work and leadership. And in addition, in terms of the UFT team, in particular, I want to really thank Bryn King, of course, Barbara Fallon, Nicolette, Joe Kamala, Trevon Edwards. And in particular, thank you so much, Trevon, that he has been not only from the very beginning, but before knowing Trevon for a number of years, that his passion for looking at anti-Black racism and really being able to bring such an amazing analysis. Certainly appreciate your work and your passion around the work, Trevon, and bringing and partnering with us in that, as well as Maya. And continuing to do amazing work. Maya, thank you so much for all that you do. Tara, who can't be here, and Kanisha Williams. So it's just such a powerful, amazing dream team that we've been able to work with here at the OACAS. And this is just a couple of examples of the products that we've been working on. There are a number of them in the works that you're going to hear about a little bit later on, but really wanting to take time to thank all of you for your partnership. But in particular, you're going to hear from Bryn and Trevon right now, who are going to extend their brilliance to us on this work that they've been able to help guide and support us with in terms of their research. So over to you, Bryn and Trevon, to take it from here.
Thank you, Nicole. I so appreciate the appreciation. And I know Trevon and I and the rest of the research team really appreciate being sort of contributing to this work in a meaningful way and really partnering around ensuring that we're using this data to tell the truth. And I really appreciated that content, like sort of that, I like that term, the level setting that you've done, Nicole, around like, what does it mean to do this work, to use data in the service of community and really to sort of help contextualize the data and help to push it forward in the hopes of policy, practice, and systems change. So that's super exciting for us. And this report is really beautiful. I love this first image, and thank you so much to the whole One Vision, One Voice team to develop this. Keisha, Facey, Chazara, Nucha, Vanya, Patrick, And I know that there's a second last name in there. What is it?
Drake's.
There it is. There it is. Thanks, Fania. And the graphics team to develop this report and to help make these data come alive. And again, you've already acknowledged our full research team. The other folks that I want to sort of acknowledge here is the full OIS team. These data would not be possible without Barb Fallon and the whole OIS team, who are not here, but they sort of make this possible, and also the workers who take the time to complete those forms about their investigation. We know it's an arduous process, but again, we wouldn't have these data without all of these contributions. So this is the product of many people's effort. And Shazara, maybe you can talk little bit about this cover art.
Oh yeah, for sure. Just a note about the artist, Chelsea Charles. She's an illustrator who resides in Brampton, Ontario, and has received her BAA in illustration at Sheridan College. She creates her illustrations through a combination of digital and traditional mediums. And so the cover art represents a hand stretched out with kola nuts, a symbol of hospitality and respect. The kola nut has important meaning within West African cultures and throughout the diaspora. The nut is bitter. We know what is in the report. It's unpalatable and bitter in terms of the glaring overrepresentation and disparities. It's also often used in ceremonies and meetings as a gesture of goodwill, welcome, unity, and reconciliation. In these ceremonies, sometimes it is the youngest person that breaks the nut. We want to invite and center the experiences of Black children and families in this work and use their voices to inform change. It also speaks to survival, resiliency, and the ability to endure in hopes of a better day. I'm kind of reminded of Nicole's quote of resistance in our DNA. And during the Middle Passage, enslaved Africans often used kola nuts to make the water drinkable aboard the ships. And so we see that symbolism as kind of seen in that report.
Thank you, Chizara. We should have that in the report, just that beautiful description. I think that should be in the report. Anyway, okay. Can we, so what I'm gonna do is do a bit of a orientation to the full report. So this is the list of figures, the list of tables. There's a lot of data in here. It's just starting at the executive summary, just reminding everybody that the data that are generated here represent is a representational sample of representative, that's the word I'm looking for, representative sample of investigations across Ontario. It reflects what is known about the case during the investigation. These are cross-sectional data. So we don't know about about maltreatment that wasn't reported or investigated. We don't know what happens beyond that 45-day period. And the characteristics that we're talking about represent the worker's best judgment about what was going on in the case at that time. So we've already seen, so we sort of, I'm gonna orient you to some of the data. We've talked about the disproportionality. I won't say it again because Nicole did such a lovely job. We talked about some of the disparate outcomes within the investigation, sort of at a population level, which is that first box on the upper left, and then like among the investigation population, what is the sort of additional, what are the additional disparities after we account for that investigation disparity? And that investigation disparity kind of drives everything else. That 2.2 times more likely to be investigated is really about sort of the overrepresentation and the disparate representation of Black children coming to the front door of the child welfare system. And then the second graph, or the second figure below that, really talks about, once children are investigated, what are the additional disparities at each decision point? We've talked about those investigation disparities, who's making the referrals, and then what are some of the child and household characteristics of Black children and families. Yes, we can keep scrolling. We also looked at you've also heard about the socioeconomic circumstances and then the nature of the investigation. And clearly, we'll just pause one second here. One thing that I would just add that we've done some work around is sort of the link between school referrals and concerns about physical abuse. And those two things are tied together. And yes, the art is beautiful. The report is beautiful. I've spoken to the methodology. Barb did an amazing job in describing the methodology. Is there anything you would want me to reiterate here, Barb, that I haven't covered?
No, I think if anyone wants to know more, just email me.
And that there are references in there, and you can look at the full OAS report, which is on CWRP website. And then here's where we want to pause a little bit. This is one of the pieces that Trevon and I and another team of folks that we work with, including Maya Kagan Cassidy, Kenesha William, Faiza Mohammed, who she and Trevon led this paper that we draw from a lot for this context piece. There's other contributors, including who Barb had mentioned before, Dr. Antwi Bwasiako, Alo Igor, and Jason King, who all contributed to that paper. And we drew from that paper in order to really talk about the context of that front door that I was just talking about. So I'm turning it over to Trevon Edwards, our esteemed colleague and doctoral student at Factor and Montage Faculty of Social Work.
Thanks, Bren. So when saying the context, it's super important that we understand that anti-Black racism is interwoven into every fabric of the social, economic, and political system that is meant to support citizens and help them succeed. And with that conceptualization, with that starting point, we understand that oftentimes issues of disproportionality and disparities can be seen as symptoms of anti-Black racism and white supremacy. So when we start from that point, it helps us really understand how anti-Black racism penetrates through structural, institutional forces that then lead and seep into child welfare policy. And we have this beautiful model that Faiza, myself, and the entire team, including Kenesha, Dr. Antwi Bwasiako, Jason, Alo, have developed that really helps paint this picture. So you can see at the top, there's this line, a strong force of anti-Black racism, once again, seeps through immigration, income inequality, residential segregation, that then shapes institutional settings and practices that happen in mental health settings, educational settings, legal settings, that directly impact Black families, right? This creates the circumstances in which Black families are navigating and are surveilled under. And to the right of that, you see then the child welfare policies that match the exact circumstances of anti-Black racism and those hardships. So child welfare often intervenes for these symptoms of anti-Black racism that leads to the disproportionate driving of Black families' contact to the child welfare system.
And the only thing I'll add here is because Barbara and Nicole did such a good job of really talking about the impact of the sort of risk assessment and eligibility spectrum, but just to say that we sort of have two competing forces in our policy around the front door of the system, which is this extremely high liability and high threshold in terms of, anxiety around reporting. At the same time, it's really coupled with a low threshold for what needs to be reported. So these two things really combine to, in addition to what Trevon talked about, where what we conceptualize as risk is really the circumstances and conditions that anti-Black racism, colonialism create to kind of interact in this very specific way to drive the overrepresentation in terms of disparate referrals to child welfare. And so in the rest of this chapter, in this section of this report, we go into a bit more detail about this. We can sort of scroll through it and there's more information, more detail about that. And then there's a lot of data tables. So if you're really interested, it's not so many, but there we talk about service disposition, and this is more detailed information, what are the definitions for each of these things, and what is the data. We can sort of scroll through. The first section is on service dispositions. We're looking at investigations, referral sources, transfers to ongoing services, who goes to court, and who's placed in out-of-home care. And then in the next chapter, we look at investigation reason. We've sort of covered this in both the presentation and in the executive summary. The other thing that we look at in this section is really about substantiation decisions, who's substantiated, what are some of the characteristics of substantiated maltreatment investigations? And then we move into child and caregiver functioning concerns, and both in the executive summary and in the presentation, we sort of did the high level of that, but in this section, you can really get into some of the more specific child functioning concerns. You see this full list here. And then there's also the primary caregiver risk factors that we have more detail on, and there's more specific data comparing, just again to note, comparing Black children investigations involving Black children to those involving white children. And then the last section is really those household characteristics and socioeconomic circumstances. Again, what another lovely, this is that last illustration is one of my favorites also. And again, sort of speak to source of income and socioeconomic circumstances. And then that is the report. So much of the data that was presented today, and money for basic necessities, sort of extreme economic hardship. Much of the data that was presented today is here in the report, as well as the context that sort of drives the investigation disparities. And I think that's it for me to pause and turn it back over to Keisha.
Thank you so much, Bryn. And I agree. I love the artwork that is throughout the report. Although it makes the information is difficult to digest, as Chazara mentioned, but the representation of the cola nuts and the possibility and the resilience is also included within the report. So we're hoping that we can use this as a foundation or a continuation of the work that we're doing to address the disparities for Black families in the child welfare system. And to do that, another thing that we're planning to also do with the great folks at the U of T is a project that looks specifically at the inflection points that are creating the disparities that we're seeing in the child welfare system. And we're calling it our disparity mapping project. And maybe I'll toss it back to you, Bryn and Trevon, to speak into that a little bit. And I know that Vanya also wanted to touch on how all of these connect with the work that we're doing at OVOV. And then hopefully we can take some questions from those of you that are here today.
And yes, and I'm super excited to talk about the Mapping Disparities Project, but I also want to sort of speak to another key piece of this, which will also inform the Disparity Mapping Project, which is the longitudinal piece that sort of builds from these data. So I'm going to just pop it over to you, Barb, and then I'll come back and talk about the disparities mapping work.
So for agencies that participated in the 2018 study, there are 18 of them, we went back to them and asked permission to essentially use those investigations as an entry cohort and track those children and families longitudinally. We did that, of course, within a governance model, a clear governance model, and through the Research Ethics Board at the University of Toronto. And we have 100% complete race data. We will then be able to look at children longitudinally. So that means that 2 years from the entry cohort, 2018, and maybe a little bit longer, depending on the construction of the data set, which is keeping us awake at night, but we're very, very close. We'll be able to look at differences and disparities between white and Black children, but longitudinally. So we're very excited and grateful that One Vision, One Voice is also supporting us in that work. And once we get that data set together, we will be coming back as a group and seeing what kinds of questions we can answer through those data. Is that okay, Bryn?
Yes. So I think that we've sort of conceptualized that work as also informing this disparity mapping project, which the bulk of the disparity mapping project is really to understand from a worker perspective, what are the challenges that Black families who are in the system are dealing with, but also to get at this sort of dialectic between what are policies and practices. I love the 4 pernicious P's, and I love Ken Hardy, and I need to find the 4 pernicious P's. If he's written about it anywhere, I got to find it. because it so informs this policy work that our team is doing. But to really get at this conversation, like what's happening in terms of what are the policy structures, what are the practices, what are the challenges, what's happening, to sort of figure out those inflection points where disparities emerge, where they are maintained, where they're increased, where they're ameliorated, and to really get a worker sense of how that's happening, and to begin to map that out. And to do that, I'm turning it over to the project director for this, Trevon Edwards.
Thanks, Bryn. So in order to investigate this phenomenon, One Vision, One Voice and the University of Toronto team are partnering on this project to better understand the worker experiences at specific decision-making points for Black families served at various Ontario CSs. So right now we're actually recruiting frontline workers, supervisors, agency leaders who are currently employed within the system or have worked there within the last 5 years. So if you know anyone or if you yourself are interested, feel free to reach out to me at any time and we can get you involved.
And there's going to be a fuller push around recruitment very shortly.
Very, very soon, yeah.
Thank you, Bryn. Thank you, Trevon. Thank you, Barbara. And now to Vanya, who wants to talk a little bit about specifically the work we're doing here at OVOV.
Yes, thanks, Keisha. Right, so as Keisha mentioned, the One Vision, One Voice program, or objectives and our on-the-ground work directly stem from this sort of data that has been shared today. So in terms of the program itself, One Vision, One Voice, we aim to bring awareness to and to mitigate the glaring disparities and disproportionalities experienced by African Canadian children, youth, and families within the child welfare sector. So One Vision, One Voice has conceptualized, and we are delivering a number of programs, written guides, and training sessions and symposiums that directly aim to address, mitigate, and correct the disparities and disproportionalities that were highlighted in the data today. So we have, for example, the disparity mapping project, which Trevon and Bryn already spoke to. Like Bryn mentioned, the project is being used to highlight the need to identify not only the key drivers into the child welfare system for Black families, but also what occurs across the continuum for Black families once they are involved in the system. In a few weeks, One Vision, One Voice will also be hosting a policy forum. We're very excited about it. And at this forum, we'll be disseminating data like what was shared today. We'll also be hearing from key voices across a number of sectors within Ontario to bring greater awareness of the experiences of anti-Black racism within each sector, connected directly or indirectly to child welfare, and to brainstorm and determine possibilities for change. Our goal is also to be able to influence any problematic policies and practices based on the qualitative and quantitative data that we are continuously collecting, so that these policies and practices are no longer built on the skeleton of anti-Black racism. And while One Vision, One Voice, we work to reduce and eliminate these disparities and disproportionalities, we also acknowledge that there will be African Canadian children, youth, and families who are in legitimate contact with the child welfare sector. So understanding the data allows us to conceptualize and share with agencies some best practices for service delivery. So these best practices that we are formulating will allow agencies to better cater from a culturally relevant and responsive lens and assist with building agency capacity within the community. Data such as what was shared with you today also allowed us to formulate and roll out the African Canadian Leadership Mentorship Program. And this program aims to elevate interested, experienced African Canadian staff within the child welfare sector to ensure that they have a more significant and equitable presence in roles of leadership, so that they're able to play a significant role in decision-making at their agencies and with advocacy on behalf of African Canadian children, youth, and families. The data also speaks to the importance of anti-Black racism leadership training. So this ABR leadership training we also provide for the purpose of building capacity for staff who would be interacting with African Canadian children, youth, and families. And finally, One Vision, One Voice is committed to continually providing general support to agencies and maintaining transparency and open channels of communication. We aim to increase awareness and operationalize the theories around anti-Black racism, social justice, and equity in practice. So we see then for sure how this report today significantly ties into the work OVOV is doing across our programs. Keisha, I'll turn it back to you.
Thank you so much, Vanya. So we wanted to open it up for any questions that anyone might have in terms of the information that was shared today. So yeah, the floor is over to everyone else.
I guess if I could take a stab here, for the folks that don't know me, I'm relatively new to the space. My name is Jay. I'm the Director of Diversity, Equity, and Comms at Durham CAS. I'm just blown away by all the work here. This is incredible. But we know that we have to put some of these pieces into practice now and see some results in our communities. And I wonder, what's the best way to disseminate this information to the communities? I'm sure we all sit on a number of community committees, external committees. We certainly have a number at Durham CES. What's the best way to disseminate this to the community? There was talk of an event next month, if I got that right. Yeah, I understand some of the stuff is on the website, but we know that some of our community folks either due to lack of access or because they don't have access. But what's the best way to really demonstrate this to the community, but also demonstrate to them what this will look like in practice?
Thanks, Jay. Oh, Nicole, go ahead. I saw you came off mute real quick. Go ahead.
No, feel free. I was just going to start off by saying that so there's been a number of references in the chat, of course, around electronic copies of the report that's available, and for community members, you know, when you do have, if and when you do have in-person community meetings, the ability to kind of print and have these copies of these reports available is also an option too. And I haven't seen it on paper just yet, but I'm sure it's beautiful on paper as much as it is virtual in kind of virtual spaces. So we would encourage folks to also print it if you need to and have copies for agencies available, for committees available. But I think that your question though is a really good one, Jane, with regards to a report in terms of issues of anti-Black racism is one thing, but really what the community is looking for is how is this going to inform change in practice? Because a report can only, a report only speaks to, it's a static way of engaging this issue, but what they really want is around the plans, around how are we operationalizing within our local agencies the different areas of the report, and how are we taking truth that we spoke about in terms of actions of reconciling through our actions and through our behaviors. And so really that's the part for me that is really significant, and that's the part that communities will be hugely invested in, is hearing about the plan. And it doesn't mean that you have to break everything down and have a multi-year, multifaceted plan, but at least some clear steps in terms of what are the short-term wins, what are the short-term low-hanging fruit that could be in ways in which you can engage both in data collection within your organization, but actually speaking to a lot of the race-based practices within One Vision, One Voice, but also the other tools that are available through One Vision, One Voice and our equity work that Kristen leads within our organization to kind of bring the two together in order to start to make headway within your organization and articulate to your community that demonstration of bringing theory or putting theory into practice, which is really what they would be invested in wanting to hear.
Thank you, Nicole.
Any other questions, thoughts, reflections?
I have a question and a reflection. Hi, Nicole, it's Vicky.
Hi, Vicky.
Hi, this is phenomenal work. And I was going to write in the chat and then I deleted it, but it really is a beautiful and inspiring report. And I'm very grateful for everyone who contributed to it. So thank you so much. And I apologize if I missed it a little bit earlier, but I'm just wondering if we could talk a little bit more about the next steps as it relates to the sector consultations or the communities. I might have missed it. I might have been a little bit distracted at the moment and I apologize. But when I think about, yes, we can look internally. Yes, we need to look at our data. Yes, we need to examine and interrogate our practices and our decisions at every step along the way in a family's journey through our service continuum. And, again, when I reflect on the data about the reports that come to our attention, how the different sectors, particularly education and police, are informing the reports that come to us. I know that there was some mention, and it went by really quick, and I'm just wondering what that work looks like in terms of the conversations with our community partners. We say that we can't do this work alone and in isolation, and we need the whole community. And at the flip side, we know that the community is what is driving, the work and bringing families to our attention and the over surveillance of particular communities. And so, or is there any advice about, having these conversations in our respective communities? So either if folks could comment on maybe what's planned on a larger sector basis, and also any advice for what we could do in our own local communities with our sector partners. Thanks.
Thanks, Vicki. Keisha, do you want to kick us off and then I can jump in on this?
Sure, no problem. So the main thing is, like, we know that the data, as Shazara mentioned in the chat, that it's about having the data. It's also about finding ways to quantify the experiences of Black families within the system. But we know that having the data is one step. It's a huge step, but it's important for us to be able to look at the different supports and services that are being offered by, not just One Vision, One Voice. We know that Kristen, whose hand is up, has a lot of things as well that is going to be coming out through the sector to address inequities across identities. But mainly it's about being able to interact with it. Like we have, if I think of the example of the ACLNP, which is the African Canadian Leadership Mentorship Program, which Danya mentioned, this really not just only looks at elevating Black folks into positions of leadership. It also looks at how are organizations currently structured to uphold white supremacy, right? How are they currently working with families, but what are we doing to break down those barriers that exist for Black staff? We know that there are a lot of staff that have been in direct service positions or in middle management roles who know exactly what needs to happen, what needs to be done, right? They were the ones who informed the ACLMP, as well as the service delivery best practices guide that we're also releasing. How are agencies implementing all of these products and these theories into practice, right? In addition, how are we measuring for success? Like, how do we know that we have this data, we have these things that we're putting out to say, here's some supports for you? Are we measuring along the way to see that we're actually creating changes and that the disparities are actually lessening for Black families? So while there are tools that we're providing, it's important for agencies to be able to not just look at them as, oh, just another tool or just another product, but to really understand that there's a lot of thought and effort and energy that goes into it, and the data and the research behind it. And we're trying to continue to move things forward in that way. We know that it's important to obviously work within community as well. And there's not one OVOV product that doesn't speak to that as well, right? Like, we know community is at the center of it. We're informed by community. We've got members of our provincial advisory committee that are also attending this meeting today. They're invested in seeing these changes for the Black community. So it's important for us to ensure that we're bringing community into the center of the discussion as well. So those are just a few things. And I think Nicole wanted to add to that as well.
Yeah. For sure. And I know that, so there's a couple of agencies that are actively engaging in referral partners, and I know Peel is one, in terms of at a local level, looking at and bringing education and police and potentially health at the table. Certainly Toronto CAS, that was also a project that had been started in my time of being there as well, in terms of bringing our referral partners at the time to the table to engage in critical discussions around the actual engagement and understanding that these pipelines of overrepresentation in child welfare is a collective, it's actually a collective disproportionate outcome that we all need to own. And by engaging the data and using the data as a tool to talk about the localized data. And I remember showing them, like, this is how much referrals, how many referrals we get from you, school board, and how many referrals we get from you, police, and engaging in critical dialogue and discussion, and leveraging not only what's happening locally, but using this type of report to then bring it into, these are also provincial patterns. And how are we going to now work together to address anti-Black racism that's perpetuated throughout all of our systems, and the fact that we all engage and create this pipeline of disparate outcomes for the Black community. And so this is the type of critical dialogue that needs to take place. And I certainly would, and I think there's a number of references also within this is also one of the references within One Vision, One Voice in terms of best practice. But we're also trying to engage this conversation at a provincial level in terms of engaging the Ministry of Education with Minister Stephen Lecce, and had a couple, and setting up another meeting with him. But also we've been engaged with the provincial OPP around some of what they're observing and how we can work together. But there are a number of provincial sites that when we talk about some of these disparities from a macro lens that we're certainly working towards in terms of bringing this conversation to as many systemic, in targeted systemic ways in how we can address this. But certainly it needs to be a multi-pronged effort where it's also happening at the local kind of jurisdictional level, where you're also pulling your partners to the table to have this kind of dialogue, and actually not just have the dialogue, but come up with actions and processes and engagement, and hold each other accountable from a systems point of view in terms of how we're going to start to monitor and change those outcomes together. Kristen, and then Karen.
Thank you. Thank you to everyone for this presentation and for the report. I feel like the word beautiful is not the right word because of the results in the report, but the way that it has been done and laid out for everyone's eyes to see the truth, it is quite beautiful. I'm struck by a couple of things. One of them was a point that Trayvon, you had said earlier around knowing the truth already around anti-Black racism. So we are no longer at the place and space where we are wondering if it is true. We know it is true, and so let it embed and infuse the work going forward. And so I think that's a critical point in this work. And then for those that are looking for further visuals or tools, I think somebody has, I think Allison, you had said this in the chat as well. I was struck by that image where it showed the structural forces of anti-Black racism leading down the path into institutional anti-Black racism, and then the outputs of what's happening right at the agency level of the eligibility spectrum, of the duty to report, of the policies and procedures. So that image alone, I think, is a really great tool. If you are wondering when and how is the time to operationalize the work on dismantling anti-Black racism, that is a great image to inform the work ahead in your own work plans, in your own operational planning at your agency. So thank you so much for all of that work in the report. It's quite something, but just wanted to share my enthusiasm for the work going ahead and what I saw as these key points. And so Barbara Fallon, I know that you always say it so well around, you know, if there's anti-Black racist outputs, or inputs, you will see anti-Black racist outputs. And so that also lays true in the report. So thank you so much.
Thank you, Kristen. Karen?
Yeah, hi. Thank you for this morning. This is amazing. And like Kristen, it's not beautiful information, but it's beautifully put together. And I just was thinking about something we started at Durham was anti-Black racism consults. So every family that's identified as Black comes through a consult process with the worker, the supervisor, and myself and the supervisor of our African Canadian team. So it's a really good opportunity for everybody to come together and discuss the situation, see where the anti-Black racism is. And we're finding patterns developing through that. Like we're finding certain schools are reporting more. And it's kind of led to other thoughts as to how we can intervene. So I can see from starting something small or small-ish, it leads to a bigger understanding of where we really need to put in the work. So, that's led to us revising our protocol with the school boards. So it's just, you can start from a very small place and just expand, and it brings us to those bigger overarching principles. So that's all I wanted to say.
Thanks, Karen, and I really do like that approach around really taking a targeted, focused approach. I know there's a number of agencies who have different iterations around whether it be dedicated teams, dedicated consult teams, dedicated on-the-ground teams to really look at anti-Black racism specifically. And I think the trick to that is having the focus teams, but also building capacity throughout the entire organization at the very same time, because what we don't want is an over-reliance on, well, that issue is going to be taken care of by the Black people and on the Black team in the corner, right? But that we need to understand that everyone is implicated in this in terms of white workers, racialized workers, even Black workers, in terms of how we perpetuate these ideas and within in terms of white supremacy and how it comes through our practice. And so I think it's, although, really support the targeted approach and the yes and to building capacity of everybody at the very same time in order to move forward. So thank you so much for that example.
You're welcome.
Erin?
So I think we're getting low on time, so I'll be really quick. I just wanted to know if this kind of work, if anyone knows if this kind of work has been done in any other sector, like I'm thinking education and policing, because I'm thinking that would be like, and you said that earlier, Nicole, that bringing in those sectors, that this has really got to be we've got to really dig into this as a whole community. And I mean, I've got lots of ideas about, it sounds like similar to Peel about, okay, pulling in these partners, but it would be great to know if they've done any of their own work on this.
Yeah, that's a really tricky one, and certainly I would appreciate any other insight that you may have, Keisha and team, Benny and Shazara. To my knowledge, yes, the work is happening. In terms of to this level of rigor, I know there's tons of research in terms of education and anti-Black racism that exists, but how the school board is now pulling that into creating specific responses, I think we just like our sector, there are the uptake is better in some jurisdictions versus others, and that you see it like really, you really see the difference in terms of the type of leadership through which the point of emphasis around equity work and anti-Black racism work and the uptake of that and the accountability that's actually within the school board itself. So it varies just like our child welfare experience varies. And I think probably of police, school, and child welfare, from my observations, police is probably the one lagging the most behind. But again, I could be wrong. That's just an observation. So I think that we all have a lot of work to do is at the end of the day. And we're certainly, although we could commend and recognize some of the amazing work that's being done within child welfare, there's like when we look at the actual outcomes and numbers, we know that creating products and reports is only, again, that's not enough to actually shift the work. We need to have workers and leaders who are actively engaged in the act of change, right? And so we certainly have a long way to go for that. So, but I do think that there's some semblance of the work, and there's different agencies and jurisdictions that are further and ahead, and some that are way far behind. But certainly happy to hear if anyone else has any observations to share around that.
No, I think you put it really well, Nicole. And I mean, this is something that we're hoping to really explore a little bit further at the policy forum that we're planning to host in May, where we really look at the different sectors and what their response has been to anti-Black racism and successes that they've seen, and in terms of the data and the overall experiences of Black families that are utilizing all of those different systems. So we hope to explore that a little bit further, but it's a great question. Thank you. And I am very conscious of the time, that it is 11:33, and we had planned to spend 90 minutes with you all. So I'm going to actually, before we close, I just wanted to send it back over to Nicole for some final words and final thoughts before we end the meeting. So back to you, Nicole.
Thank you. Just a vote of thanks to everyone for making the time, for being here, and in particular, really appreciate our U of T colleagues who have been helping us with the heavy lift of really moving the work and making change, and putting not only not just a theoretical exercise, but it's one again that is about transformation of practice and transformation of systems, so that we can improve outcomes. So I started with a quote. I'm going to end with one. This is a quote that spoke to me from Frederick Douglass. And it says, "If there is no struggle, there's no progress." And so we're inviting you into the struggle with us, that this is not a singular struggle that's just on the backs of Black communities, but cross identities, cross systems, that we all have to engage in this critical struggle, so that we can start to see the change in outcomes for Black families and for Black children and youth that we support. And so this is a call, an open call for us to roll up our sleeves, engage in the struggle, so that we can start to see progress. So thank you all. Thank you for being here, and have a wonderful Friday and a great weekend. Be safe.